Hello, friend. In this video, we will talk about a very important topic that is how to deliver bad news to our patients. As you know, although we try our level best, we give our 110%. But in medicine, there is not always good news. There is a lot of dreadful diagnosis, bad outcomes that we must tell our patients in a timely manner along with empathy and giving them the sense of that what is the next step, what we can do along with our patients as a team in that grateful diagnosis situation. For example, recently I had a patient who was at his late 30s, no smoking history, however, a strong family history of lung disease. During the routine workup, he was found to have multiple big nodules in the chest X-ray. Then we did chest CT that showed metastatic lung cancer. As you can see, this is a patient at his 30 with no past medical history, but now as his physician, you must have to give this news to the patient, to the family. So in this video, I want to talk about a mnemonic that you can utilize easily to give bad news to your patients in an empathic way as well as in an impactful way. Because during delivering the bad news, we must not sugarcoat. This is our patient's right to know all the information in a timely manner and very importantly in a clear way so that they understand what are the options they have available and what they can do about this situation. So before we jump right into it about that mnemonic, how to deliver bad news, I want to thank you for joining this video. My name is Dr. Hoque. I am the Associate Professor of Medicine, currently practicing in the US. So what I will do, I will share my screen so it will be much easier for you to see the mnemonic step by step. I will break down this mnemonic step by step. As you can see, the mnemonic is spikes. So let's break down what is this spikes about that you can utilize for delivering bad news. So first is S. S for setting. So what will be the setting when you deliver the bad news to the patient? It must need to be a private, a comfortable, and in a place that, okay, you are concentrating 100% while talking to the patient as well as like no interruption. We need to be aware about their privacy, about the HIPAA. So choose a private place where you have less interruption. If you are having any phone, put them in mute. If you have a pager, hold them for now until you deliver this bad news to your patient. Now, list is P. So what is this P? P is perception. Ask what is the patient's perception or understanding of the diagnosis, or simply ask them what do they think, what is going on about their health. Now is I for invitation. Ask patient how much they would like to know. Give them heads up that, okay, you have a bad news to deliver, but ask them, is it good time? Ask them how much they want to know. You can phrase that, okay, many of my patients, they want to know everything in detail. On the other hand, many of my patients, they want to know in a very concise manner, or if you want, we can talk about in other time. So invite that are they ready to discuss and hear about this bad news. Then K for knowledge. This is your time to explain the patient about the disease, about the maybe the result, the biopsy test, or what is the important information you want to give the patient. So patient has good knowledge about the current circumstances and diagnosis. Explain the disease, the care options, the risk versus benefit of the treatment of medication during this stage. And then is E. E for emotion. Doesn't matter what you tell the patient. If the patient is afraid, if the patient is crying, scared, doesn't matter how much evidence-based information you give to the patient, nothing will go to their head. So this is the time after giving the knowledge about the disease, about the treatment. This is the time for them to maybe show emotion. If they are crying, if they are scared, pause. Give them the tissue, give them water, give them your support that, okay, you are here for them. Respect and acknowledge patient's emotion. Maybe you can tell that, okay, I see you are scared. I see that it must be a very hard news for you. So acknowledge their emotion. And S for summarize. Because, this is an overwhelmed situation. And you went to medical school, your patients did not. So maybe many terms are much easier for you that your patients do not know. It's quite impossible for them to understand and remember, even though maybe they are highly educated or highly successful in their own field. So take your time at this last stage to summarize that, okay, what is the main thing you addressed and what they need to know, remind them, and very importantly, tell them that, okay, what will be the next direction. For example, next direction could be the patient need to follow up with a radiation oncologist or an oncologist. The next step could be patient need to talk to a surgeon, or maybe simply patient will tell that, okay, I'm not ready today. I want to bring my family for a next meeting. So what will be that appointment? So here is the friend. This is the mnemonic spikes for delivering bad news. Again, to recap quickly, S for setting, choose a private place, quiet place. P for perception, understand patient's understanding of their disease and diagnosis. I for invitation, ask patient how much they want to know, or is it good time for them to know. K for knowledge. This is your time to give them the knowledge about the diagnosis, about the disease, about the possible treatment plan or possible outcomes. E for emotion. Acknowledge and respect patient's emotion. And last S is for summarize. Recap and tell them what is the biggest thing you guys discussed, as well as what will be the next step. Because without telling the next step, there is no impact of delivering bad news. People understand that, okay, this is a deadly diagnosis, but everybody wants to know what is next step so that they can, do whatever they have with their life, and they are prepared that, okay, what they need to do next with their life. So I hope you find these mnemonic spikes helpful for delivering bad news, and let me know how does it go for you when you are utilizing this mnemonic, maybe as an intern, as resident, or as attending physician. Because regardless of our specialty, the truth is we have to give bad news to our patients, to our families. And do not keep it at the last moment. Delivering bad news require timely action as well as preparation for us as physicians to make sure we are delivering the bad news in a timely manner as well as in an empathetic manner. I Hope you will like this video and share with your friends whom you believe will be benefited from the educational objectives of this video. Please subscribe to this channel because your support means a lot to me. It gives me motivation to make more educational videos like you for your professional growth. Thank you so much for joining me today. I will see you in the next video. Until then, take care and take care of yourself, take care of your patients. Bye bye.